Flu season in Texas is off to an early start this year, and right now we're not seeing any signs of it slowing down. Tarrant County Public Health says Texas is one of multiple states in the country with very high levels of flu. Our partners at the Star-Telegram say statewide nearly 8% of clinic patients had flu-like symptoms, so patients are going to the doctor for fever, coughs, and sore throats. To protect yourself, experts say get the flu shot and the updated COVID booster. The flu shot is recommended for anyone 6 months and older. And of course, wash your hands often, cover your mouth when you cough, and stay home if you aren't feeling well. From the flu to RSV to COVID, a lot of people sick right now, just as we head into the holidays when we're going to be seeing families. So joining me to talk about it right now, Dr. David Winter from Baylor Scott White Health. Good morning, Dr. Winter.
Good morning, Chris. Good to see you.
Yes, and so many things to worry about, it seems, right now. Let's start with influenza. What's the latest? How bad is this flu season going to be?
Well, as you said, there's lots of cases there on the uptick right now. In fact, the cases are higher than they've been in the last 10 years. Lots of influenza out there. So if you're worried about Thanksgiving parties getting together, you might want to take precautions. You talked about the flu shot. I believe in those. Staying away from crowds is also a good idea. I don't see many of these masks out there now, but they still work. You might want to be careful because influenza's out there. It's quick to spread, and it's going to be a bad year for influenza coming up, Chris.
Might have to bring back the mask. Okay, we're also seeing lots of RSV, or at least we've talked about it lately, especially with these children's hospitals. Is it still packing those children's units?
Yes, it is. If you look nationwide, about 75% of all children's hospital beds are full still. The new thing we've seen is older folks are starting to come down with this also. So if you're older and you have impaired lungs or hearts, if you're frail, you need to be worried about this. The RSV virus makes lots of secretions. That's harder for older folks that are sick and for young babies to clear. That leads to bronchitis and pneumonia. So RSV is still a problem right now.
And that old COVID virus, it seems like we're not hearing about it as much lately, but it is still changing and there are new variants taking over. So what is the status of COVID in America right now? Yeah, you can say bye to BA4, BA5. Those were the dominant variants this past year. They're going away, and the new kid on the block is BQ.1 and BQ.1.1. Both those variants, they're taking over. They spread faster, they're more contagious. So far, we're not seeing a big surge with this. We worry about that, though, because these things are going to be out there, and we're expecting, as the cold weather come in, a big surge could happen with COVID. Okay, so when talking about these new variants, each one seems to have its own set of characteristics. Is it possible they could mess up our holiday festivities? Because this is the time of year when people are traveling, getting on airplanes and whatnot.
Yeah, I do worry about that quite a bit. Here's the big concern. Right now, there's not a lot of COVID. It's kind of steadily rolling along, but we're afraid that it could get worse. Here's the big concern. If you look at people who've had COVID within the last 6 months or had a COVID shot within the last 6 months, that's the minority of folks. So the majority of people actually don't have that collective immunity. So when this COVID, these new variants start to take off, they could take off rapidly. So I'm very much concerned about that, Chris.
Switching gears a little bit, we're hearing about new medications for weight loss. Are these something that you recommend at this point?
Yeah, this is real interesting. I've had a lot of people contact me about this. The old weight loss pills revved up your metabolism. That makes you burn up more calories, also made you nervous, sweaty, anxious. And when you stop those, typically you'd gain back the weight or more. These new medications work differently. They actually slow the stomach from emptying. So when you eat, you get full quicker, and you don't get hungry quicker after that. The drugs are called glucagon peptide drugs, or GLP drugs. They're actually designed for diabetes, but they also work in non-diabetics to slow down the emptying of the stomach and help you lose weight. They've been very successful. The problem is they're very expensive, and most of those require a shot into the belly. So some downsides about that. You must have a prescription, but if you're worried about weight loss, something new to talk to your doctor about.
All right, we're all thinking about those extra pounds during the holiday season. Dr. David Winter, thank you for joining us this midday.
Good to be with you. Thank you, Chris.